So there's novel clinical approaches for pain, and cannabinoid receptor agonists, so stimulators of these receptors, have shown therapeutic value against inflammatory and neuropathic pains, conditions that are often refractory to therapy. In fact, most of us have seen that we have tried many things in our tool bag and have not gotten the job done. So as we look at the fact that although the psychoactive effects of these substances have limited clinical progress to study cannabinoid action in pain mechanisms, preclinical research is progressing rapidly. This was from a 2006 article, and I quoted it. So what's interesting is that indeed, over the last 12 years plus, we have seen a tremendous progress, and as well as reports in the clinical literature that we can use the activation of the cannabinoid receptors as well as other pathways that are stimulated by the cannabinoid pathways to actually help with pain. For example, CB1-mediated suppression of mast cell activation responses, CB2-mediated indirect stimulation of opioid receptors located primarily in the afferent pathways, and the discovery of inhibitors for either the transporters or the enzymes degrading endocannabinoids are recent findings that suggest new therapeutic approaches to avoid central nervous system side effects. So once again, if we use a high THC product, so not hemp, but a marijuana version of cannabis sativa, we're going to have some central nervous system issues and some psychoactive effect. But what we see here in this quote is CB1-mediated suppression of mast cell activation. Well, mast cells are part of our allergic pathway, which also fuels inflammatory pathways more often than not. But also what we see here is CB2-mediated indirect stimulation of opioid receptors located in the primary afferent sensory pathways. So what we're seeing is that the cannabinoids have their direct effect, and in addition, a secondary effect, including possibly on opioid receptors. So we start looking at the opioid crisis, how people have become dependent upon this for pain management. We're starting to see a window that we might explore and also take advantage of.